My name's David Vickers. I'm a children's doctor, so a paediatrician, and I've worked for the last 15 years or so with young people with chronic fatigue syndrome. But more recently, I've become part of the team who's supporting young people who have long COVID. So it's great to meet you this evening. I'm looking forward to trying to answer your questions.
Hi, I'm Amber. I'm volunteering with Young Healthwatch. My first question is, what are the symptoms that young people experience who have long-term COVID, and how long is it likely to last?
I mean, that's a really good question. I think long COVID is a new condition. We are learning about it all the time. So although I'm seeing young people with it, like most people, I don't have lots of experience. But what we are seeing is that it's a real problem for young people. It causes a number of particular difficulties. The main one is fatigue, so feeling tired. And that's not just tired because they've been busy in the day. It's fatigue all the time, which impacts on their ability to do things like go to school, socialise with their friends, do activities out of school. And that's fatigue that lasts for a long time. The other thing that young people talk about is what we call brain fog. So it's difficult to understand what's going on around them. Concentration's difficult, forget things, what's called short-term memory problems. Of course, both those things are really difficult if you're going to school or you're going to college, because you can't then learn and you can't interact with your friends. And there's a number of other things that young people talk about. So aches and pains, sometimes a fast heart rate, so they feel their heart beating quickly in their chest, sometimes breathlessness. The other question you ask is how long does it go on for? And to be honest, we don't know the answer to that question. COVID's only been around for a couple of years, so people with long COVID, which is having COVID and then symptoms going on for a long time, it's still a new condition. What we do know from people who've had similar conditions, like chronic fatigue syndrome, is that young people get better. So what we say to young people who come to our clinic is the likelihood is you'll get completely better, but it's going to take a little while.
In your experience, does the vaccine reduce the effect of long COVID?
That's another really good question. We don't know the answer to that. What we do think is true, however, is that having the vaccine makes it less likely you'll get long COVID. So people who've had the vaccine and also have had COVID seem less likely to go on to get longer term symptoms. So having the vaccine is a good thing to protect you against getting long COVID.
What does long COVID prevent young people from doing?
Well, I think it affects all parts of life. So if you're going to school, the first thing it affects is your ability to go to school. So sometimes people are not able to get into school at all. Other people get into school part-time, or they manage to get into school all the time, but they're not doing anything else outside school. So often what we hear is, I go to school, I come back, I'm absolutely exhausted, wiped out, I go to bed, I go to sleep, I do nothing at weekends. And that doesn't sound like much of a life for somebody. All you can do is do education.
I heard the vaccine cause autism in young people. Have you seen this in any of your patients?
Absolutely not. And I think that's a really important thing to be clear about. Nobody has suggested that the vaccine could cause autism. You probably remember that a few years ago there was a lot of anxiety about what's called measles, mumps, rubella vaccine, MMR, causing autism. And we're really clear that that vaccine did not cause autism. And we've had nothing to suggest that this vaccine causes autism either. It does have some side effects, we know about that. Lots of people talk about having mild aches and pains or a bit of a temperature afterwards. Some people have had, rarely, some problems with chest pain due to inflammation of the heart, which actually gets better. But for most people, the vaccine is really safe and it's really good at protecting people against COVID, becoming unwell with COVID, and we think probably against protecting you from getting long COVID as well.
Okay. What advice would you give to a young person deciding whether to have the vaccine?
Well, I think that the first advice I give is to have the vaccine, but also to make sure that you understand the benefits of the vaccine and why you're having it. Because what you shouldn't do is just go along and say, I'm having the vaccine because I'm told to do. So I think look at the information that's available, look at the NHS website, look at the leaflets that you can get, and if you can get easily. And if you're worried about it, do you have any concerns, talk to your parents, talk to a health professional, and to get reassurance that it is the right thing to do.
Thank you.